So
vertebral
your
artery
C1
test.
anterior is going to be that. C1 posterior is going to be that. And then side glides like that. So that's just to check the integrity of the upper cervical, and they'll have weird symptoms, tingling bilaterally in the arms or legs or both, numbness, any of that, nauseousness, dizziness, double vision, tingling in the face, any of that stuff that just should not be happening.
Okay.
Or maybe they have so much muscle guard and you just can't move them.
Right.
That's a sign they probably have a fracture up there.
Okay.
Because they're. So then once that's cleared, and it's important you do that first, because if they have that going on, instability, the last thing you want to do is put them into this position.
Right.
Okay? But if that's going on, have them look to the ceiling, slowly bring them over, look up to the ceiling, and have them count back from 20. Okay? And you do that because you're looking for slurred speech, so you want them to speak out loud, 20, 19, 18, etc. And they're going to count back from 20. And if they have any of those symptoms I just mentioned,
okay, so now with this test, this is one of the precautionary tests, right?
For vertebral artery.
Yes. And we would look at that if they come in.
Trauma?
Right.
Any kind of trauma or anything that just isn't adding up to you. They have some red flags. You want to do that.
Okay.
Now, the literature does state that this test may not be as specific and sensitive as we'd like it to be.
Right.
But it also, in our practices, it's the best we have.
Right.
Okay? In conjunction with our whole exam.
Okay.
It's not like we're just doing this and saying,
right.
okay, they're fine. But you can pick up some positive people, and you'll miss some people that should be positive.
And they're not.
And they're not. But again, it's the best we have,
right.
and that's what we use.
Okay.
We don't have Star Trek
right.
MRI iPads to look through his,
right.
his neck and see how his arteries are working.
Right.
We don't have that. This is what we have. So, I've heard people. You can sit up. I've heard people talk about, well, because it's just not a great test, we shouldn't do it. I don't know. I've